It's important to know what is a pulpitis. A pulpitis is the inflammation of the dental pulp. We have three main causes: the bacterial, physical, and chemicals. In the bacterial that are the most common, we have pathogens such as Streptococcus mutans, Lactobacillus, and anaerobic species. In the physical irritants, we have the frictional heat, drying of dentin, excessive depth of preparation, condensing pressures. And in chemicals, we have the use of acid, restorative materials, or acidic diets. These are very important to know what could cause a pulpitis. Now we are going to talk about a reversible pulpitis. A reversible pulpitis will be defined by a mild inflammation of the pulp with reparative capacity once the cause has been eliminated. In other words, a reversible pulpitis occurs when the decay hasn't reached the pulp, affecting only the dentin, but the bacterial toxins cause the pulp to be irritated and reversible the inflammation. It's important to know that this reversible pulpitis will cause a pain that is sometimes sharp with a duration less of 20 minutes and is easily to be located. Now we have to know the signs of a reversible pulpitis. A reversible pulpitis could be have a signs of a dental caries, an exposed dentin, a trauma, a cavity preparation without refrigeration, or defective restorations. We have to know the symptoms. It's important to be considerate that a reversible pulpitis will have a pain that is transient. It can be sensitivity to a cold and to heat. This is very important to know the symptoms of a reversible pulpitis because it's different of a irreversible pulpitis.
How do we diagnose a reversible pulpitis? First, a correct anamnesis must be taken for the patient to provide us data on the qualities of the pain, how long the discomfort has been present, and the factors for improvement or worsening. Then, an extra and intraoral clinical examination must be performed to evaluate a possible cause such as caries, but not all causes of reversible pulpitis are clinically visible, so the following steps are mandatory. Pulp vitality test. They include the cold test, the heat test, electrical test, percussion, palpation, and mobility. Finally, as a complementary diagnostic tool, radiography is used to observe what is happening in the tooth. For example, we can see the depth of a cavity, but if it isn't a colossal trauma, the tooth will appear intact. We can only observe a slight widening of the periodontal space. For the vitality test, which we will perform with relative isolation in the cold test, which will be carried out by placing a cotton with refrigerant sprayed endo ice, will give a moderately painful response with a slow cessation that disappears at 3 seconds. In the heat test, by placing a hot song in the cupboard cupboard, the answer will also be moderately painful with a slow cessation, and in the vertical percussion test, it could be slightly sensitive or not feel anything. This will vary depending on the cause. For example, if it is a reversible pulpitis for closer trauma, the ligament will also become inflamed and the patient will feel a slight pain. In mobility tests, there will be not many changes. If the cause affect the periodontal ligament, there could be a light degree of mobility. At palpation, the patient will not feel greater discomfort. since in reversible pulpitis there is still no abscess or fluctuation. Finally, in the electrical test, the vitalometry will mark 10, which means that the pulp is still alive. The treatment will focus on eliminating the cause, so that doesn't become an irreversible pulpitis.